Hi, my name is Christon Taylor and my student number is N303-50065. Today we'll be doing a presentation on collaborative working and I will start with the introduction. In the beginning and first learning outcome, we will talk about communication, teamwork, and motivation, and the importance of this within collaborative working, and how the governance of this structure formalizes innovation. We will then move on to learning outcome 2, where we'll talk about the conflict of management and indulge with theories to deliver other communication criterias. Moving on to LO3, where we will discuss the professional relationships and how it instigates services and theories suggesting systems of collaboration within the sector. And lastly, in learning outcome 4, we will speak about the importance of professional relationships and the roles and factors by initiating professional relationships within the sector. And finally, I will finish off with the conclusion. So I'll pass on to my teammate to start LO1. Thank you. Goodbye.
Hello, my name is Sana Ahmed. My student's number N303499798. Today I want to speak about communication, motivation, and teamwork. The other dealing of the system are involved with the collaboration of the healthcare service and the series in the cases of special psychological approach, which is engaged with the delivering of gaining the proper aspect of healthcare. It is also managed into the portion including with a series of influencing with the environmental factors. In the case of the negative impacts, this is involved with the series of understanding about attribution of the behavior and order and other condition. It is also involved with the condition developing, developing the other aspects, maintaining the motivation and dealing with the other states. The other, in the other respect, is developing the team work theory, the Tuckman's theory, which is delivering about the team development. It's explain the establishment of leadership style and other collaboration styles. In other aspects, in the included within the condition maintaining the development of the maturity and ability to deliver to connection. It's also establish the other connection, which is the motivation involved with the Maslow, the following theory res, res, respects the understanding of safety, need, and belongings. It is also analyzed into progress of indicated think the theory development the main streams. Now I'm finished. My colleague they will start for hello.
Hello, my name is Minda Quay. My student ID is N303-50561. My topic about my presentation is about conflict management. Let's dive into it. The entire section delivers a portion mangling about the hospital service and how it depicts the rules. It also mentions the challenges and the conflicts related to the hospitals and various healthcare services. It's also involved with the process of meeting other main indicators of the system. The collaboration theory is all engaged within the conditions, delivered about the high level of thinking streams. It's also involved with hiring with the proper setup of the oral communication. It is also associated within the development and the leadership skills, inducing other services. In this way, it helps to highlight a session involved in the proper conditions. In all possible rounds, it's maintaining the condition of the proper delivering of the situation and involving the categories in hospital gradation. The work and its implications are all assignated to apply competing standards. It's also involved with the major conflicts of the system and also managing the other style of services, and is also maintaining the aspect of the condition. In other cases, it's also dealing the vulnerable feature of the system and also maintaining the different roles of the system. I would like to continue with my partner in my group team to take on to the LO3.
Hi, my name is Glenda Busefarinas, and my student ID number is N303-50084. And I'm here to discuss about the LO3 professional relationships. The case studies of NHS are involved with adequately administering high quality of care and the proper development. It is mainly associated with maintaining the appropriate services of healthcare sectors, concerning the valuable features of the condition and maintaining the other roles. It is also involved with the section delivering the main activities and suggesting the conditions. In the case of health practice, that is mainly involved in maintaining balance and keeping the stability of the body function appropriately. It is also highlights the main segments by meeting the formal requirements of the conditions. In NHS supports the services by implicating the primary condition. In other roles, it is indicated within the services meeting the other conditions of the system. There is a huge importance of professional relationships in health and social care sector. It is based on professionalism and principles of the sector. Relationship-centered working is personalized that is maintained by delivering safe and care support. Families and friends are also playing the most important critical role in the development of professional relationships. The following procedure is there to indulge in the conditions, delivering such a situation, and also analyzes other roles of the system. And now I'm going to pass you on to my other team member for the LO for discussion. Thank you very much.
Hi, my name is Moldoveanu Cătălin Constantin. My student number is 303-50352, and today I'm going to talk about LO4. It's the importance of professional relationship. Good working relationship is the most important to improving the care standards within the industry. It facilitates cooperation and provides more significant opportunities to learn about health needs. Modern healthcare sector consumers are expected from the higher premium. There are also present some case studies which are offering the problem of Haywood Rheumatology Center, which is a part of the NHS Trust, Integrated Health and Social Care Provider. The main aim was to get the patients out of the hospital by maintaining the secondary, primary and community settings. The Imperial Child Health General Practice comprises 2 or 3 approaches that switch to a population of 4,000 children. The hub consists of specialist outreach, open access and public engagement. There are some causes of success and problem for the org placement that support the patient's needs from following the discharge from the hospital. The relationship between the King's Funds and SCA aims to improve the value of the services that are required to deliver the highest quality outcome for the patient who are admitted both to the outwards and inwards care units of the hospital. Service includes dermatology and minor surgery services that are required by the patients in the hospital. At the time of financial resources, local and national NHS leader needs to focus on improving the quality and delivering a better care unit in the hospital. The relationship between the King's Funds and SW aims to use the public data safely to improve health care. Now I'm gonna let my other colleague from the team to come up with the conclusion. Thank you.
Hi, my name is Christon Taylor. My student number is 303 50065. I'll be concluding our presentation starting by explaining the most important roles within collaborative working, which we've found out to be communication, teamwork, and motivation. Communication is needed to relay information from person to person or company to company, maybe from professional to patient. The teamwork to get the work done is also needed and very important, as we all are a team and we all work together. This is how work is managed to be taken out. Motivation to come to work is very important, to know that sometimes some days are not as easy as other days, but to keep going and knowing that delivering care is our first and foremost priority. Teamwork, motivation and communication is the most important for the development of professional relationships within healthcare. Collaborative working helps to manage conflicts, challenges, and hamper ineffective professional relationships. These are the aims that we wish to fulfill within health and social care. I hope you enjoyed my conclusion and our presentation. Thank you very much for listening. Goodbye.